our, I think I'm down to my last two slides, yeah, before we call it a day. Another scenario is as shown on your screen. Okay, so smoking cessation. This is an example. It's very long, so I will not read it. Okay, just um yeah, I will not read it because it's too long. I will just read the first part. Okay, you are a nurse in a respiratory ward. Your patient Celine Carey is admitted again in your ward due to recurrent exacerbation of COPD. She is still smoking a pack of cigarette a day. You are about to see her to check her observation, and the CSW in your bay told you that Celine is asking about smoking cessation program. Okay, so your patient is asking about the smoking cessation program. So this is your article, okay? This is your article. It's very long. I will not read it, but I think this article, it talks about nicotine and other replacement therapies for smoking. So on your marking criteria, these are the things that you have to write, okay? So again, you have to provide at least a short summary on what the article is all about. So normally we advise our candidates to write to say 3 or 4 sentences about the article, what the article is all about. So similar to to the example I've given you on the that with regards to diabetes. Okay, so try to, if you have the time, probably take a picture of this scenario and write your own answer. Okay, try to take a photo and then write your own answer based on this scenario. So number three, what are the things required with number three? Inform the patient that replacement therapies have not been found to achieve the same level of satisfaction as smoking. However, e-cigarettes have higher rates of satisfaction compared with nicotine replacement. Actually, by reading the marking criteria, you will then understand what is the studies all about. So say number three, that e-cigarette will not get the same result or effect as the actual smoking. Number four, discusses with the patient that studies show that stopping smoking is more likely when using e-cigarette than nicotine replacement. Oh, okay. All right. We then understand that. Okay, that e-cigarette more successful than nicotine replacements, such as patch or gum. Number five, advises that e-cigarette are more likely to cause throat and mouth irritation compared with nicotine replacement. Okay. Number six, you have the advice the nicotine replacement therapies are more likely to cause nausea. Number seven, you have to emphasize that without face-to-face support, there is low efficacy for both treatments and recommendation that the patient use smoking cessation support service, signposting them to the local service. So what local service they are referring to? They might referring to the NHS Stop Smoking or your smoking cessation team. And lastly, you have to positively acknowledge the consideration of giving up smoking by offering support and encouragement. Of course, we all need that. Someone who could support us, encourage us in in quitting smoking. Okay, so this is an example. Again, on my example, I did not write everything because I want you to think what you're going to write. Okay, I only provided couple of examples. So let's say number five. Um, I will advise Mrs. Carey that e-cigarettes are more likely to cause throat and mouth irritation compared with nicotine replacement. That is easy, right? Let's say number seven. I will advise that nicotine replacement therapies are more likely to cause nausea. Okay, and lastly, on another example is number seven. I will also emphasize that without face-to-face support, there is low efficacy for both treatments and recommends that the patient use a smoking cessation support service, signposting them to the local service, okay, or services. For example, again, guys, you have to write everything. I just given couple of examples. So that is our last example. Any question so far? So the marking criteria will guide you. So before, I think this is the last slide of my presentation before we call it a night. So these are the other criteria or the other scenarios for examination. So we have your female myocardial infarction, your pressure ulcer, and your use of honey dressing. So for female, remember the reason why it's female because the presenting symptoms for female are different as compared to male. So let's quickly read it. So you have again to summarize, so you have to write it clearly and legibly because remember, if the assessor could not understand what you've written, it may result to a fail. Okay. So Starting from number three, you have to recognize the importance of early and correct recognition of MI, and it's vital in to seek medical care promptly for better outcome. You have to inform the patient that as a female, she may or may not experience chest pain. Chest pain. Okay, so that is the main reason why they're writing a female myocardial infarction. Number five, you have to inform that the patient may experience, we all know this, nausea, back, shoulder, throat, neck, cheek, teeth, and arm pain. Okay, number six, you have to emphasize to the patient that she should report any symptoms whether she considers them to be cardiac related or not. And of course, to call 999 immediately if in case she experiences any of these symptoms. Okay. So from number three to number seven, all of this should be reflected or should be written in your evidence-based practice. Of course, you have to provide a short summary about what the article is all about. Okay. So second to the last is your pressure ulcer prevention. Again, give a summary, write clearly and legibly. Number three, you have to inform the patient about specific foam. Preventative dressing applied to a person's sacrum has been shown to reduce pressure ulcer development by 10%. However, even with a dressing, he may still develop a pressure ulcer, although it may occur later. Oh, so that is based from research. Okay. So you have to then explain that a very rare side effect of the foam dressing is mild skin irritation. You have to advise the patient that being male, he may be at most risk of developing pressure sore. And explain to the patient that regular skin inspection, regular changing position, staying well hydrated, and maintaining balanced diet will also help with prevention of pressure ulcer. Guys, this could be one of your interventions for your pressure ulcer if you're writing this as your care plan. Number seven, informs the patient that there is a foam dressing that may aid in the prevention of pressure ulcer, and this will be discussed further with tissue viability team. So we had the discussion with tissue viability team last time during our planning. Remember when to refer to a tissue viability nurse. Hopefully you still remember that. Okay. And lastly, the last scenario for this evidence-based practice is the use of honey dressing for venous leg ulcer. So again, summarize, write clearly and legibly, starting from number three. You have to inform the patient that there is currently no conclusive evidence indicating the medical grade honey improves outcome for patient with chronic venous leg ulcer. So that's based from the study, okay? Saying basically that's not too effective. Number four, you have to inform the patient that one large study found no reduction in size of ulcer or healing time with honey compared with standard treatment. You have to advise that in the same study, patient reported an increased rate of pain. So number six, you have to then advise another study suggests that honey may have antimicrobial properties and may help patients with chronic venous leg ulcer who have MRSA infection. However, this may be very small study and more research is required of the subject. Number seven, you have to inform the patient that there is no evidence that medical grade honey is cost effective in the treatment of chronic venous leg ulcer. Okay, that is based from the study. And lastly, to recommend that until further research is conducted and the efficacy of honey to treat chronic venous leg ulcer is established, the dressing of the wound should be based on the current evidence-based trust protocol. So that is the end of our webinar today. So any question? So this is now your opportunity to ask me any question. I hope our session today is useful. Okay. So guys, my tip from now on, if you're doing the new test of competence, start remembering, understanding, and memorize the marking criteria for evaluation, of course, for your professional values and evidence-based practice. And keep writing. Okay, keep writing. Any questions? So on